Our lead story tonight, well, India has set a grim global record, recording 3,14,835 cases in one day. Now, this is the highest cases ever recorded during the COVID pandemic in the world. The United States had crossed 3 lakh earlier, but India has topped that with 3,14,000. Also, what's worrying is that India has taken just 17 days from 1 lakh a day to 3 lakh plus a day. The US took 62 days. And India's cases today are higher than America's highest number of daily cases. Remember also that it's so difficult to actually get test results. So even these numbers don't indicate the real surge. Also, in just 44 days, India's 7-day average of daily deaths have gone from less than 100 to over 1,600 today as a weekly average. There's no sign of any turnaround yet. In the last 24 hours, our deaths recorded were 2,104, the second highest in the world in the last 24 hours after Brazil. On the 9th of March, there were just 77 COVID deaths reported in India. But right now, the biggest shortage in India, and this is an emergency, is the oxygen emergency. Today, the Prime Minister chaired a high-level meeting on oxygen supply with senior officials. He's ordered them to increase the production of oxygen and to increase the speed of oxygen distribution, adding that they must come down heavily on hoarding and ensure smooth supply to states. However, this came after hospital in Delhi was sending out desperate SOS messages. Hospitals went to the Delhi High Court, and so many hospitals actually reached out to NDTV to get their message heard, they said, by higher authorities. Through the day, this is what Delhi hospitals, and not just Delhi, Bhopal hospitals, Gurgaon hospitals, were all appealing for life-saving oxygen.
Struggling to breathe, Saurabh Bharadwaj, MLA from Delhi, is pleading central and Haryana government to help Delhi with oxygen supplies, as Delhi faces acute shortage of oxygen, with many hospitals with just hours of oxygen left.
मैं इस हॉस्पिटल में हूँ, यहाँ की ऑक्सीजन भी 3 घंटे की बची है। मैं सेंट्रल गवर्नमेंट और हरियाणा गवर्नमेंट को ये रिक्वेस्ट करता हूँ कि इस तरीके की चीज़ें ना करें। बहुत सारे लोग इस ऑक्सीजन पे डिपेंडेंट हैं।
51-year-old Ashish Goyal pleads with folded hands for oxygen supply for his hospitalized father, who is on ventilator at Delhi's Saroj Super Speciality Hospital. After hospital authorities informed Mr. Goyal that only 15 minutes of oxygen is left at the hospital.
हर अब 15 मिनट की बैकअप आ रहा है कि 15 मिनट में ही ऑक्सीजन खत्म होने वाली है। पूरे लोग सब ऑक्सीजन के लिए बहुत परेशान हैं। हॉस्पिटल भी बहुत कोशिश कर रहा है कि किसी तरीके से ऑक्सीजन आए, और अदरवाइज अगर ऑक्सीजन नहीं मिलती है तो बहुत यहाँ पे पेशेंट्स की जान को खतरा होने वाला है।
In a major respite to over 150 COVID patients, Saroj Super Speciality Hospital received a tanker of medical oxygen. However, the situation remains critical in several other hospitals. In a private hospital in Ghaziabad, ambulances, instead of transporting patients, are now transporting oxygen cylinders to be refilled. The situation in Vaishali's Lakshmi Chandra Hospital is extremely critical, with 118 COVID patients and nearly an hour of oxygen left.
कोई ऑक्सीजन सप्लाई नहीं है।
नहीं, फिलहाल में तो नेगेटिव हो जा रहा, तो रिपोर्ट आई
कुछ भी है। मैं अस्पताल में किसी मरीज को भर्ती करने की पोजीशन पे नहीं हूँ। ऑक्सीजन आ नहीं रही है।
Upset with the present scenario, MD Mukesh Goyal has written a letter to the administration appealing them to take over the hospital.
ऐसी कंडीशन के अंदर हमने शासन से भी कहा, शासन कोशिश कर रहा है, लेकिन कोई सफलता मिल नहीं रही है। तो आखिर में मजबूरन होकर हमने कहा कि शासन हमारा हॉस्पिटल टेक ओवर कर ले, जिस तरह से चाहे हमारा पूरा स्टाफ उसको कोऑपरेट करेगा। कम से कम हम अपना जो टाइम है वो मरीजों के इलाज के लिए लगा सकते हैं।
Shanti Mukund Hospital, another hospital in East Delhi, has started discharging patients who are not on oxygen support due to the lack of oxygen. The hospital alleges that the firm responsible for providing oxygen has stopped responding to our calls.
हमारे पास 110 पेशेंट एडमिटेड है, इसमें से अराउंड 12 वेंटिलेटर पे हैं और 85 मोर देन 5 लीटर ऑक्सीजन है, और सारे के सारे सिक पेशेंट्स हैं। और जो हमारे कुछ पेशेंट जो डिस्चार्ज हो सकते हैं उनको डिस्चार्ज करने को बोल दिया।
Meanwhile, the Delhi High Court gave stringent direction to the central government for smooth supply of oxygen to the hospitals. A special corridor for oxygen transportation adequate security for the tankers. If anyone stops, obstructs the movement of oxygen, criminal action will be taken against them. Earlier, the central government had claimed that to meet the exponential rise in demand, it has increased quota of oxygen for 7 states.
The COVID-19 situation in the country has deteriorated so much right now that despite the efforts from the central as well as the state government, several hospitals, especially in Delhi NCR, are reporting shortage in oxygen for COVID-19 patients that are admitted in these hospitals. And the lives of hundreds of COVID patients are dependent on these kind of oxygen cylinders. And these cylinders are somehow managing to keep them alive. With camera person Sushil Rathi and correspondent Saurav Shukla and Ravi Ranjan Shukla, I'm Akshay Dongre for NDTV.
This as the Delhi government has said that no oxygen stock is left in 6 private hospitals. But the situation is so bad, as we saw in that hospital authorities begging for oxygen. This CEO of a small hospital in Delhi actually breaks down saying, what can we do? Patients will die.
We probably, you see, we as a doctor, we as a hospital, we are supposed to give life. If we cannot give them oxygen even, what is the situation? When patient comes to, patient will die. Patient will die. We know they are trying to help, but there is no oxygen, sir. There is no oxygen. We know this. We know, everybody knows this. Even government is trying to help us. But ultimately, oxygen is to be generated and to supplied.
It's a situation which really is a national emergency. Well, joining me now is Sangeeta Reddy, Joint Managing Director for Apollo Hospitals, the largest private chain of hospitals in India. Sangeeta Reddy, we've seen from all across hospitals are actually reaching out to NDTV. They're going on Twitter to try to get their appeal heard for oxygen, that states are blocking it. How has it come to this, and what do you think is really needed desperately now? We know the Prime Minister chaired a meeting. There's again a meeting with oxygen manufacturers tomorrow. What are the SOS measures we need to take now to make sure this doesn't happen?
So, Sonia, I think this is a significant and a serious situation which is facing the whole country, and hospital operators across the country are extremely desperate. But of course, in 5 or 7 states, the situation is worse than in the rest of the country. So this morning we had a critical situation in our hospital in Delhi. And so I tweeted, of course, but I also reached out and, I'm happy to say that from multiple counts, we did get a response. Whether it was the Haryana police, the joint managing director of Inox, who is our supplier, said that his truck was not able to move. And what happened immediately or very shortly after that was not only was the truck allowed to move, but we saw that even from the previous night, Delhi government had been working. But also the FICCI president reached out to the Home Minister. Right. And Home Minister has issued an order today saying that there should be allowed free access and free movement of oxygen tankers. So let me explain this for a minute. See, basically, India produces more medical grade oxygen than we need. And that is a significant data point. Almost a week ago, Shri Piyush Goyal chaired a meeting where he requested all industry grade oxygen to be diverted to medical oxygen, which is actually what Kerala started doing almost 1.5 months ago. Right. The critical shortage today, because you asked me what do we need to do, the critical shortage today is not really oxygen, but the tankers and the cylinders which transport the oxygen from the generation point to the hospitals where they are needed. So one of the immediate and critical things is to enhance the effectiveness of the delivery system. So the tankers that are moving up and down should not be stopped and blocked at borders.
Absolutely.
So that is why my tweet said, please treat an oxygen tanker like an ambulance and give it a clear path that will increase its effectiveness. So point number 1 is that.
I think it's very important because it's like almost like an organ transplant, like the green corridor should be given with that level of urgency.
You're absolutely right, Sonia. So that is the need right now. So we enhance effectiveness of the oxygen we have in the cylinders we have. In parallel, we have to make more tankers and cylinders. That is a critical need as well, because this kind of situation is probably going to sustain for another month, if not longer. So we must gear up by having more tankers and more cylinders. The next thing which we ourselves as hospitals, like we did this in Apollo, is to enhance the productivity of the oxygen that we have. So look at efficiency measures in oxygen. Number one, check all leakages. This is a safety factor. So all our quality teams have done that. Also, the criteria for giving of oxygen, make sure that patients who have a saturation only below 93 or 94, you start oxygen and start with only 2 liters. So the protocols can be slightly modified, but also ensure that you're proning the patient so that you get higher effectiveness. Now we are sharing these protocols with nursing homes and hospitals, and most people are following this.
No, these are very important points. I'm seeing it going all around really about proning and the use of it and this rationalizing. But, you know, that's happening at Apollo, which still has the resources, the large scale across the country. But the worry is that what's happening in these small nursing homes and hospitals. You saw just now that CEO breakdown. And even from Apollo and hospitals like Max, our top private hospital chains, we got SOS messages saying there's a few hours left. What is it like for doctors? What is the administration actually going through when you're running out of oxygen or a tanker stuck in Haryana? And remember, Haryana feels they need the oxygen too. How do you decide where that tanker has to go? What is it like for you, Sangeeta Reddy, and for doctors and nurses who actually have to speak to those patients and their families? We saw the Innashik tragedy yesterday as well. It's heartbreaking.
So Sonia, it's an unbelievable tension, and basically what we are trying to do is shield our patients, our staff and the public from this, and we are absorbing. So our CEOs, everybody is in the act. Our CEO most of them were up till 2 in the morning making sure that their supplies are in place, because we don't want patients worrying about oxygen. That is our responsibility, and when we cannot handle it ourselves, we look up to the government. And I must say that the Home Minister, everybody has been very supportive and very helpful. They've understood the need. As you know, Prime Minister is also having a meeting about this. Health Ministry reached out about ensuring that the efficiency usage protocol is shared with all nursing homes.
Absolutely.
This discussion is happening from the Health Ministry. So I think everybody is working together.
Let's
really make sure that nobody is hoarding oxygen, and that we can make sure that it reaches the people who really need it.
Absolutely. It's a national emergency, Sangeeta Reddy, the Supreme Court said. We all have to come together to fight this together. That's the need of the hour. Thank you, Sangeeta Reddy, for coming and speaking on this, because we talked about safety. We talked about what patients' relatives go through. From Nashik, Purva Chitnis reports a day after that tragedy where 24 people died because they didn't have oxygen because of an oxygen leak. What is actually happening on the ground on the supply of oxygen? Remember, Nashik is the one district in Maharashtra which has the highest cases.
46-year-old Vaishali Raut died in the Nashik oxygen leak tragedy before her elder son's eyes.
अंदर एडमिट किया था तो वेंटिलेटर पे थी और ऑक्सीजन ख़त्म हो गया, इसकी वजह से मेरे माँ गुजर गई.
उनको थोड़ा सा समझना चाहिए, इतना बड़ा हॉस्पिटल है, आज 200 के करीब उसमें पेशेंट मरीज है, तो उन्होंने कुछ तो भी बैकअप रखना चाहिए था ऐसा.
In Nashik, India's worst hit city by per million population, the health infrastructure is in dire conditions. Vinayak Pardeshi, a 45-year-old rickshaw driver who stays about 50 kilometers away from Nashik, is desperately searching for answers. His mother, admitted since 15 days at Nashik Civil Hospital, was on oxygen. But Vinayak says her bed was changed last night, and this morning his 70-year-old mother is no more.
मेरे मम्मी का इधर रात में बेड चेंज कर दिया, वे तो वो अभी तक जिंदा रहती थी, मालूम है? कौन भरपाई देगा उनका अभी?
Families are desperate for key medicines, remdesivir and tocilizumab, as well as for oxygen beds.
मेरे अजी का ऑक्सीजन अभी 88 था और जब एडमिट किया था अभी वो कम हो गया, 80-81 वक्त का है. रेमडेसिविर तीसरा दिन हो गया, नहीं मिल रहा है.
अपने महाराष्ट्र शासन को, राज्य जी टोपे को ये रिक्वेस्ट करूंगा, जो अपन पॉजिटिव का टेस्ट करते हैं उसका रिपोर्ट पेशेंट को तुरंत 2 घंटे में कि 1 दिन में तो ही मिलना चाहिए. तो रिलेटिव को होश में आएगा, रिलेटिव बात कर सकते हैं, पेशेंट को किधर तो एडमिट कर सकते.
At Nashik, many private hospitals are running low on oxygen. At Ramalai Hospital, the oxygen Dura cylinder was refilled just once in last 4 days. The cylinder now is empty, and about 50 patients are in the hospital.
In our hospital, we require around 90-95 cylinders daily.
but now we are getting only 30 to 35 cylinders.
How are you managing them?
Ma'am, we have a central line O2 system, but now we are just managing the critical patients on O2. And we are just informing the patients before admissions only that there is a lot of shortage of O2. Since morning 7 o'clock, there is no O2 in the hospital.
Government says that they are trying their level best to keep up with the health infrastructure. But the question arises that how exactly did we then prepare ourselves for this second wave? In Innashik with camera person Rajendra Dayalkar, this is Purva Chitnis for NDTV.
And breaking news coming in just now, the Election Commission has banned campaigning in West Bengal for the last few phases. Arvind joins me for more on that. Now remember, today there was a campaign. The Prime Minister today announced that he's cancelling his 4 rallies scheduled for tomorrow. He'll address a virtual rally tomorrow. Amit Shah, however, addressed 1 rally. He had 3 rallies scheduled today. He cancelled 2 of them, flew back for COVID meetings. Mamata Banerjee went ahead with the campaign rallies but made the point why the Election Commission hadn't actually clubbed the last phases together as the TMC had asked for. Arvind has more details. Arvind, so the Election Commission, perhaps after strong words from the Calcutta High Court today, has finally acted, well, banning in a sense large public meetings but agreeing to 500 people. I mean, that's also way too large. Arvind, go ahead.
Yeah, Sonia, the Election Commission invoking Article 324, which gives enormous powers for the Election Commission to conduct a free and fair election, has invoked this particular article and then imposed ban on all road shows, all rallies, bike rally, cycle rally or padayatra, and also all large public meetings. In fact, what in this particular order, the Election Commission has said that public meetings not beyond 500 people will be allowed. So only all the public meetings should be restricted to only 500 people, and the COVID protocol should be strictly complied with. So all other permission if that has been given earlier stands withdrawn. So that's the important order the Election Commission has given. Though they have said that all the public...
In fact, Arvind, but interestingly, they've allowed 500 people, which is in no way COVID protocol. And interestingly, that's of course what the BJP had also restricted its meetings to, 500 people. So why is 500 this magic number? Because no doctor would agree to a meeting with 500 people.
Exactly, Sonia, there is no other detail, no other reasoning for this 500 people that the Election Commission has given, because there has to be a basis for this 500 people order. Even that has not been clearly given. Another very important point, even today, again, TMC had written to the Election Commission saying that at least phase 7 and 8 should be clubbed together, but even that, the Election Commission has not taken.
So in fact, Sanket, that Election Commission, as we said, that Election Commission decision comes on a day the Calcutta High Court came down on them heavily. Also, as the Prime Minister cancelled his 4 rallies scheduled there tomorrow, Sanket has an analysis.
So as far as West Bengal is concerned, it seemed that it existed in a totally different universe, because here on planet Earth there is a pandemic, and particularly in India there has been a national COVID emergency. But it seems that after this new wave or new tsunami, finally the political class has woken up, where the Prime Minister was supposed to hold a rally yesterday is now cancelling his Bengal program. He's not going to be there physically, but he'll hold a virtual rally tomorrow at 5 p.m. for West Bengal. Amit Shah, JP Nadda have also cancelled their rallies. This decision has been taken just a short while ago. In fact, Prime Minister Modi is going to chair high-level COVID meetings tomorrow in the national capital. So that's going to be his main focus. But BJP's rally alert, in fact, came, and this is what led to a lot of criticism. It came with a smiling picture of Amit Shah, which was criticized on social media, because this was immediately being juxtaposed with the sort of oxygen emergency that India is facing right now. Then the BJP released video of Mamata rallies with no COVID protocol. Remember, she held about 4 rallies today where actually there was no COVID protocol. The TMC says that they've written to the Election Commission saying that they must club the last 2 phases of elections. TMC has told the Election Commission this is a grave risk to public health. But the Election Commission directive also has come to the political parties, where they say, many say a bit late though, if candidates will not abide by COVID protocols during campaign, action will be taken. Too little, too late, many say. Well, now the Calcutta High Court has come in, where strong observations have come in from the Calcutta High Court. They say that the Election Commission is empowered to act, but what is it doing about polls in COVID times? Election Commission is passing circulars and leaving it to people. EC isn't doing 1/10 of what TN Session had done. If EC does not act, the court will.
So let's see what the court says now with that EC decision still allowing 500 people at rallies. Meanwhile, the Prime Minister, who cancelled all his rallies tomorrow of going to Bengal, has a series of COVID key meetings tomorrow. It starts at 9 a.m. when he'll chair a meeting, look at the situation in an internal meeting. Then at 10 a.m., chief ministers of high burden states on what the situation is there. And at 12:30 p.m., a meeting with leading oxygen manufacturers in the country. That, of course, is key given our current oxygen emergency. Meanwhile, the Supreme Court has said that the oxygen shortage is almost a national emergency and interestingly has taken up the case regarding the oxygen shortages and various other COVID issues on its own. The Supreme Court added that 6 high courts are doing this, but we may withdraw some. They told the centre we want essential drugs, vaccination power and to declare lockdown as well. The bench, also comprising Justices L. Nageshwar Rao and S. Ravindra Bhatt, have issued notices to the central government on these issues. Interestingly, they've also appointed senior advocate Harish Salve as amicus curiae, the person who will assist the court. Interestingly, the Supreme Court also said that the high courts have passed certain orders which may have the effect of accelerating and prioritizing services to a certain set of people and slowing down the availability of these resources to certain other groups, whether they're local or regional. However, interestingly, today the Bombay High Court and the Delhi High Court went ahead with their hearings on these issues, even though they were both told that the Supreme Court is currently hearing these matters. They said we will go ahead with our hearings, let the Supreme Court take a decision on transferring this, and both the Bombay High Court and the Delhi High Court came down strongly on the centre, with the Bombay High Court saying that you can't let old people just die.